Well, I had to have a stoma in the first place. I had a hysterectomy, and as it was healing, I developed a fistula. And in order for the fistula for it to repair, I had a stoma done. I had a colostomy, which we didn't know at first if it would be permanent or temporary, but it ended up being permanent. Because a couple of years later, I was given the option of either having a reversal or having the rest removed, rectal excision, which, as I had a lot of problems with adhesions, we decided that it would be better to keep the stoma, which I was quite happy with, and to go ahead with the excision and keep it.
I had my surgery back in November 2010. When I got told I had to have the surgery, I was a bit wary of what was going to happen and a bit unsure how it was all going to come out, but they sat me down and talked me through it. In a way, I didn't have much choice really, because it was either have the surgery or die really, you know what I mean? It's just, but since I've had the surgery, I've been a lot better, a lot more active. I was off for 2 or 3 months, but then I got back to work and I'm feeling a lot better now. It's a lot better.
I developed my first hernia after a couple of years, but it wasn't really very serious then. It got more serious and it got much bigger after about 3 years. And in the end, it got so big that I needed an operation to repair it. I felt sick a lot of the time and I was getting a lot of pain and discomfort. It was underneath my stoma. And one thing I was having a problem with was clothing. I was having to wear clothing that was 2 sizes too big than I normally wore, because of the size of the hernia.
I developed my hernia about 6 months after my surgery. It sort of just crept up on me really. It would just appeared sort of overnight, sort of got bigger and bigger. Then I was on the 2-piece bag and it was just totally a nightmare. I couldn't bend down. Getting dressed was awkward. It's just a lot of pain getting in the way.
Things like gardening. I have a friend who comes and helps me with the gardening. I can do a little pottering about things, but I can't do any of the heavy work like the digging. And so somebody helps me with that. And I have to get people to help me with various other jobs, like cleaning, vacuuming. I'm not supposed to do that. So I have somebody to come and help me do that for me.
We carried out an assessment of around 1,000 ostomies and we discovered that around 67% of these patients were suffering from some form of leakage. We actually found that around 50% of the patients had undiagnosed herniation. There was also other causes for leakage, this being surgical scarring and creasing, and also the change in size and shape of the stoma. We wanted to try and do something about this particular problem, and we noticed really that there's an issue with conventional wafers, in that they just cannot really conform to the shape of a body, particularly with herniation. This can also lead to problems with creasing, and obviously once a wafer creases it creates a path for possible leakage. With any other wafer, if you try to conform it to a curve in the body, the change in the height that's required means that the circumference of the wafer needs to be reduced. This isn't possible with a standard wafer, so with the FlexiFit wafer we actually added compression zones, these 5 slits around the edges, which means that when you do need to put it around the curve, they can flex easily and provide excellent security.
The best things about the FlexiFit wafer is the adhesive is so more canny to your skin. It's sort of, most of your skin when it warms up, it sort of, well, it feels a lot more comfortable, a lot softer, as opposed to the older one that give me like irritation and kept my skin were peeling off. But this one, it's so natural, I think, really. It just sort of smooths into your skin and it feels so comfortable. You don't
the stoma and around any bulges with the hernia. Also, the aloe vera makes the skin much softer. I've had problems in the past with sore skin, and when you're taking the wafer off, it often tears the skin. But I've not had any problems with the aloe vera in the FlexiFit.
This new one, the FlexiFit wafer, is a lot easier, molds more with your skin, it's more natural, it feels a lot more comfortable and it gives me more confidence going out, and I feel a lot better.
The Confidence Natural FlexiFit pouches have made quite a difference in that I know that when I go out, I don't have to worry about any leakages or any problems.
As with every Salts Healthcare hydrocolloid formulation, this adhesive is accredited by the British Skin Foundation. It has extracts of aloe vera which helps to maintain moisture levels in the skin, meaning on removal there is less trauma and meaning that the peristomal skin is healthier.
I do keep recommending the FlexiFit wafers to other people. We've been to a few product launches, open days and things, and I keep telling everybody how good they are.
I would recommend the FlexiFit wafer to anybody who hasn't tried it. As I say, it's so much more comfortable, so much more friendly to your skin, give you more confidence as me, and as I say, you won't even know it's there.
So there you have it, the new FlexiFit wafer, improved security, maximum flexibility, the perfect fit for everybody.